I stand here today as part of an outstanding group of patient organizations representing the millions of patients and families and individuals and friends who have been touched by cancer across the country. We have gathered together today to provide a voice, a collective voice for patients who are alive today thanks to advanced cancer screening technologies. For some, this may have been due to an MRI detecting a tumor, or from a CAT scan detecting early signs of cancer. And because their disease was detected early, they were able to receive effective treatment and they're alive today. We're also here to speak for the millions of people who may need imaging services in the future. And those services will help those people identify their illnesses and determine the best course of treatment for the disease. And we hope that imaging will help beat their disease. We want a rejection of the massive cuts to medical imaging which have been proposed in the healthcare reform proposal. We oppose the use of radiology benefit managers in the Medicare program. It's just the wrong approach. We are deeply concerned that the proposed cuts to Medicare will jeopardize patient access to these life-saving technologies and treatments. Access to medical imaging for seniors must be protected, and it must be protected because it saves lives and it reduces costs over the long term.
At the Society, we are concerned about the policies spoken about today that enact a utilization rate increase on medical imaging equipment, and our fear that proposed Medicare requirements will lead to decreased access by seniors to needed diagnostic imaging services. We believe there's no available data that supports the arbitrary levels of utilization that MedPAC, the administration, and Congress have recommended. And without clear evidence and data to support this recommendation, we think this policy makes little sense. The Society and the other 14 groups represented here today strongly urge members of both chambers of Congress to reject calls for additional Medicare cuts to medical imaging.
I know and understand from firsthand experience the emotional roller coaster of cancer and the critical role that imaging plays in ensuring that the diagnosis is accurate and that the treatment is appropriately staged. Congress is considering cutting Medicare spending in imaging and increasing these utilization rates. And that's going to significantly reduce access to imaging in underserved areas, which happens to be one of the primary segments of the population that healthcare reform is supposed to benefit in the first place. We need patient-centered strategies to help reduce spending, and we need doctor-developed appropriateness criteria for the right scan at the right time to help us make the right call.
Early detection means a greater chance of survival, less radical treatments, surgeries, and lower costs for care. It is already difficult enough for people like me who fall under the screening guidelines to get the screenings that we need. Let's be clear, more cuts and will only lead to roadblocks in early detection and higher costs down the line. Take it from me. I have had 7 surgeries, 5 procedures, and 4 years worth of so many chemo cocktails. What we must remember here today is that every single one of us here has a compelling story to tell you. But as survivors, we are also living proof of how important and vital medical imaging is.
Please show your support for life-saving diagnostic screening by rejecting arbitrary cuts to Medicare spending for medical imaging.
Medical imaging helped save my life because it found my cancer when everyone else said that I was too young. They refused to test me because I did not fit the age criteria at 36.
Today, as a member of the Washington State Comprehensive Cancer Control Program Colon Cancer Task Force, I have serious concerns about proposed legislation that would greatly diminish patients' access to early screenings. My insurance paid over $300,000 my first year of late-stage treatment. Patients do not need more barriers to early detection and screening, but unfortunately that's exactly what will happen if imaging centers go out of business and hospitals are the only place you have to go. This would be a great hardship, especially for those who live in rural areas.
In 2002, I was invited to participate in the CT versus the X-ray study that became widely known at that time. I joined, and through the luck of the draw, I received the CT scan. And at that time, I was diagnosed with lung cancer. 7 years later, I am beating the odds, but only because of regular imaging.
I'm here today to urge members of Congress and the Obama administration not to cut reimbursements for diagnostic imaging. Rather than limiting access to advanced medical imaging, which can save lives, we need to be promoting preventative care. We need to be promoting early detection, like CT scans for people who are at risk of lung cancer. Dealing with a disease like cancer is difficult enough. We shouldn't be enacting policies that would make this fight harder for patients by forcing them to travel long distances, wait in lines, or to be pre-approved for necessary scans.
Without medical imaging, I may not have made it through my battle with breast cancer. I was a lucky one. I was caught very early. I was actually in an off year. I was 41 years old, and back then, which is just 7 years ago, it was every other year for women over 40 with no health history, or nobody in my family having it, which I fit all those parameters. So I believed in medical imaging enough to go the off year and pay for it out of pocket, which is when they found my tumor, were able to do a lumpectomy. I only had radiation, and I had no chemotherapy, and I've had no recurrences at all.
With my condition with MS, I guess I'm even more concerned about maybe the elderly in our rural areas, the poor, those people that don't have transportation. You know, we don't have regional transportation out there. So, you know, to tell somebody they can't go to a rural area or to the small town that they live in or that they're next to, and they maybe have to go 100 miles, 200 miles away, that can have a huge impact on early diagnosis and treatment for many of the conditions that people suffer from. They say the number of doctor's visits a person goes to before they're actually diagnosed with MS is 25 visits. I was diagnosed in 3. That was because of medical imaging.
What concerns me most is what will happen in our rural areas. Patients like me will be forced to drive long distances and wait